Good evening, everyone, and welcome to another episode of Q&A Wednesdays with J. Lopez, MD. For tonight's topic, it's called Get in the Zone with Testosterone Replacement Therapy Part 2. And for this evening's talk, we have a couple of guests, and they include, first off, Dr. Sigfried Galang, graduated from St. Luke's Medical Center College of Medicine in 2002. He started practicing integrative medicine in 2010, integrating the background in conventional medicine with holistic, complementary, and alternative modalities and principles. He's currently one of the doctors here at J. Lopez MD Medical Group. So tonight, let's welcome Dr. Sigfried Galang.
Hi, Dr. Joel.
Good evening, Sigfried. How are you?
I'm fine, very fine. And how about you?
I'm good, thank you so much. So this
Right.
is our second episode of testosterone replacement therapy.
Yes, interesting topic.
Yeah. So we have another guest for tonight. So he's a model, photographer, yoga teacher, and entrepreneur. He's also one of the wellness ambassadors of J. Lopez MD. So without further ado, let's all welcome Mr. Hideo Muraoka.
Hello, guys. Good evening. Hello, everyone.
Good
Hi,
evening.
Doc. Good evening.
How are you doing today?
Very good, very good. Busy day, but very good. How about you guys?
We're good as well.
Yes, just finished work.
Yes. Yes. So, for tonight's topic, it's about testosterone replacement therapy, and I know you've just had experience with testosterone recently. Can you tell us
Yes,
more about how you felt after you got started on it?
yes. This is my third week, and I can definitely feel increased energy
Mm-hmm.
and strength,
Mm-hmm.
muscle mass. I noticed that during my workout, I have more strength. The weights that I used to do, it feels easier now, feel lighter, and I'm sleeping better as well.
Okay.
But overall, my takeaway is the energy level. I feel very good, very energetic during the whole day.
Yeah, that's great to hear. So actually, Doc Sigfrid and I are also on testosterone replacement therapy. And yeah, so if I may ask you, Doc Sigfrid, how have you been doing on the TRT as well?
Well, I'm very, very happy that you put me onto testosterone replacement therapy because before that I was actually having depressed mood. So the one of the symptoms is depressed moods, and there's like a lack of desire, or I mean the lack of vitality
Mhm.
and interest in things. So I guess it was reversed after starting my testosterone replacement therapy in December of last year.
Yeah, that's
Right.
wonderful to hear.
Yes.
Yeah, I've been on testosterone myself for several years now. I started years ago, like I said, but symptoms at that time included migraine headaches. So I found out that I was low in testosterone at that time. So after getting started on it, that actually improved, and I now rarely get migraine headaches. So actually, testosterone is not only important for sexual health; it's also important for the circulatory system, bone health, mental health, and a lot of other things in men. So
Yes,
um,
you're right, Doc. I heard that it can affect the can cause heart attack in men if they
yeah,
have low testosterone.
yeah, that's right. One of the first symptoms of low testosterone could be heart attacks in men because usually men don't go to doctors unless they feel something really bad. But one of the symptoms of
Yes.
low testosterone could be like one of the first symptoms could be a heart attack. And unfortunately, most doctors don't check for testosterone levels unless a person complains of erectile dysfunction.
Okay.
Ideally, everybody needs to be tested
Oh,
because,
wow.
yeah.
That is scary for all men.
Yes, and actually, our levels begin to decline at 20 years old by 10%.
Mm.
So you can imagine how much your levels are by the time you reach a certain age.
Yeah, like for me, Doc,
Yeah.
45 years old, so it might be 75% of my teen, of my younger years.
Hmm.
So if I'm in 70, it could be half already.
Yeah, exactly.
Yeah.
So,
So,
shall we proceed? I
Wow.
think that's, yeah.
So, Doc, what exactly is the TRT, the testosterone replacement therapy?
Yeah, actually, testosterone replacement therapy is one of the modalities that we use at our office. So basically, it's the replacement of testosterone, especially when a man's levels begin to decline. And before we do this, we actually ask the person or the patient this ADAM questionnaire. It stands for androgen deficiency in aging men. So this is our screening questionnaire. And if a person says yes to two of those questions, then we begin confirmatory testing by checking a person's total testosterone. Those two important questions
Mm.
are you having decreased libido or sex drive? And the other question is, are you having erectile dysfunction? So those two are the main questions that are if answered with a yes, means that a person could possibly have testosterone deficiency. So
Okay.
anything,
Oh,
uh, Dr.
uh,
Sigfried?
so you mean that, Doc, if you have problems with sexual libido and having erectile dysfunction, you need to have your testosterone check already. It may
Yes,
be already low.
yeah. And the best time to have it tested is around 8 in the morning, 8 to 12 noon, because that's when we expect your testosterone levels to be really high. So if
the
a person's,
highest.
yeah, so if it's low, then we may do confirmatory testing.
Mm. Interesting. And Doc, how can we take steps to prevent the decline of testosterone for young men and older men as well? What steps
Yeah.
can we do to delay that process of decline?
Unfortunately, the decline begins at 20. And with today's environment, it's kind of difficult to slow down the decline of testosterone or hormone levels as we age. The reason for this is because, again, our environment, including our diet, most
Yeah.
of our diet is primarily pro-inflammatory. And when that happens, it's harder for our body to create testosterone. Instead, our body creates more of the stress hormone called cortisol. So,
Cortisol. Yeah.
yeah, I would like to show you a slide about this testosterone. Ralph, do you have it?
I've been reading something about today the modern like modern age how it declined compared to before because of lifestyle,
Yes.
food, and lack of exercise, stress. It's up here.
Yeah. So if you could see this this diagram here, most of the all the sex hormones actually are derived from cholesterol. So we need cholesterol. It's not bad. The body has a certain level of cholesterol. It's part of our cell membrane. It's also a precursor to the sex hormones. So if your cholesterol is too low, it could actually lower your levels of testosterone, and not just that, but also other hormones like estrogen and progesterone in women, and of course, testosterone in men. And there's a condition called cortisol steal. So if a person is stressed out, they would tend to form more of the hormone called cortisol. So cortisol is the stress
Mm.
hormone. So if you make more cortisol, there's less production of the other hormones. So stress really affects the production of the sex hormones.
Oh wow.
Yeah. And then
Wow.
And then besides that, of course, if a person is not having, it's having like a lot of, what do you call this? A lot of toxins that they get from their diet, it would create more of a hormonal imbalance. These toxins act like estrogen in our body. So
Mm.
a lot of younger men who have estrogen dominance, these are men who have extra body fat and less muscle mass. Yeah, they usually have more estrogen than testosterone. And this is because,
I've
again,
been reading also how important to sleep also to produce testosterone.
pardon
Like
me?
sleep early. I
Yeah, yeah,
also been reading about
Yeah.
the how sleep can affect our testosterone production as well. It's a very important process.
yeah, that's very true. And of course, we repair and regenerate our bodies during sleep. So if we don't get enough sleep, the process of regeneration doesn't happen. So it affects all, not just one hormone, but all the hormones. So when we
Yes.
do
Mm.
a person, we do a comprehensive panel. This our hormones are like a symphony or like an orchestra. If one is off, it affects the rest of the symphony or the
Yeah.
interplay of hormones.
And
That's
how
why
often do
that's why
you?
sleep.
No, sorry, Doctor.
That's why sleep is very, very important. So I know that growth hormone is also released during the first period of sleep. So that includes also testosterone and melatonin. So and right now we have a lot of um, blue light radiation, blue light exposure that affects our pineal gland, which prevents the melatonin to be released and also affects the other hormones as well. As Dr. Joe has said, it's like a symphony. Affecting one hormone will affect the others also.
Yeah. And how often do you suggest to take the blood test and check hormones level?
Yeah, after a person gets started on testosterone replacement, we usually check 6 weeks after the initial injection. We check our the client blood count because sometimes the hemoglobin or hematocrit could go up because again, testosterone is an anabolic hormone. We also check for estrogen levels, making sure that the testosterone doesn't turn into estrogen. And that's why we give estrogen blockers or aromatase inhibitors. We're all on this aromatase
Mm.
inhibitors, the one that we take 3 times a week. Yeah. So, and also, of course, we also check for the PSA just to make sure that there is no increase in PSA because sometimes testosterone could do that. It could actually cause prostate enlargement through a hormone called DH.
Mm.
Yeah.
The age. And Doc, just so I can understand, TRT, the testosterone replacement therapy, is not the same as anabolic steroids, right? The ones that you bodybuilder takes or
Yeah, that's true. Well, anabolic steroids, as per its name, anabolic is because it creates muscles, it creates tissues. Steroids because it's derived from the steroid parent hormone. So they're basically testosterone could also be considered an anabolic steroid. However, it's natural. It's the same structure as the one that our bodies produce. However, you really have to use high doses of testosterone to really get like huge, similar to those bodybuilders who use anabolic steroids. And the thing about anabolic steroids is that it doesn't have androgenic effects. So it may build muscle, but it may not, it won't affect your libido. It won't improve your libido. It won't improve a person's erectile dysfunction. It won't improve a person's cardiovascular, mental, emotional, bone health. It just works on increasing your muscle mass. So that's the
ah,
main differences.
I definitely felt that the clarity and the improvement of my energy level, not just body wise, but emotionally as well. I feel that I'm more focused, like with more clarity as well in my thinking.
Yeah, that's
That's also
wonderful.
a benefit of the TRT I've been noticing as well.
Yeah,
Besides, I noticed as well that my body, I've been getting body mass.
more muscle mass. Yeah,
Yes.
yeah, that's
That's
great.
good.
And
That's nice.
actually,
Yeah.
yeah, our approach is not just replacing testosterone, but also we advise on certain things like the paleo diet. it's important to be on a diet of meat and veggies and staying away from the grains while you're on the TRT, because if you have a lot of grains, that would actually interfere with the what do you call this, reabsorption, or the re-entry of testosterone into the circulation. So when you have a lot of grains, it would artificially lower your testosterone levels, basically. So it's important to stay away from grains as much as possible.
And then, Doc, just for the audience, what type of grains usually you should avoid?
Yeah, basically bread, rice, pasta, yeah, those things. Siegfried, anything to add?
How about vegetarians? Do they have can they what diet they should be restricting or doing?
Yeah, it could be an issue with some vegetarians because they may not get enough protein.
Yeah.
If that's the case, they may need to take some additional protein supplements, like that are plant derived. Like they could use brown rice protein, pea protein, or hemp protein. Or they could also
I'm
take
actually taking a amino acid,
yeah, that's
the one you
that's
gave me.
yeah,
It's
exactly.
an alternative, yeah.
Yeah,
Amino
and that's
acid.
really good because it's plant derived, and a lot of people don't want. Well, not all, but a lot of people avoid meat in general, especially if it's not organic.
Yeah.
Yeah.
Yeah. So this treatment, the TRT, is available with Dr. J. Lopez Clinic. The
Yeah, it's
testosterone replacement therapy.
Yeah, it's available at the clinic along with other things. If a person's level of growth hormone is also low, we could also do growth hormone replacement therapy because they actually both work synergistically. Testosterone works on the muscle mass, while growth hormone works on the connective tissues primarily, like the joint, skin, hair, nails. So it's good to use them together, ideally a person could afford it. But if a
Yes.
person could not afford it, because it's a little bit on the pricey side, they could actually use certain amino acids such as L-glutamine. Glutamine, it usually works before 50 years old. So L-glutamine, there's L-arginine, and citrulline. So these are other things that would also help.
Some of those ingredients, it's on the supplement. Then I also taking now that I got in the clinic, the Erexia Vitali.
Oh,
I've seen that has
Yes,
L-arginine and what
Tongkat
salpalmetto.
yeah. So if you have erectile dysfunction, so we also add that supplement which can help for erectile problem. So because it has L-arginine and the horny goatweed especially, and then Tongkat Ali and Tribulus terrestris, which are all important to boost the testosterone and also prolong the erection process.
And ideally, sorry, go.
Oh yeah. I was just about to say, Tribulus terrestris has been used by the Eastern Europeans. This was before the Berlin Wall got what do you call this? Before when there was still this communist bloc, the Eastern European teams would actually use Tribulus to enhance their performance. Yeah,
The athletes, no?
Wow.
That's how they they work. So instead of
The
using
secret.
Tribulus.
Secret key. So ideally, what age do you suggest to start to measure our hormones and to start the TRT?
Yeah, actually, I have clients primarily in the States who are in their late 20s who have low testosterone levels already. And most of them usually use anabolic steroids during their teenage years. So this actually interferes with their hormones. So that's why by the time they're in their late 20s or early 30s, they begin to experience symptoms of andropause.
Also premature andropause.
Yeah. So basically, it's premature aging. That's what happens when people are not, let's say, eating properly or taking care of themselves. They could experience premature aging, and testosterone deficiency is one of those conditions.
And how long is the? Of course, I think it depends on the person, but usually, how long it takes the treatment?
Yeah, it's all individualized because everybody's different. Some people, like especially if a person's like 50 and above, they would have to take it indefinitely because the levels just continue to decline as a person ages. But let's say a person who has a lot of stress problems, they're making a lot of cortisol. Once you correct the stress, sometimes they're able to produce more testosterone. So you may be able to use testosterone for them temporarily, like between 3 to 6 months.
3 to 6 months.
Yeah.
Okay.
Yeah. But again, it's all individualized because we do regular testing once we start a patient on testosterone, because again, your levels might be within the normal range. However, if a person is still symptomatic, we would continue treatment.
And
Got
in
it.
addition to that,
So I
Hideo
guess
and Dr. Joel, in
Go ahead.
addition to that, yeah, those who have low testosterone is prone also at risk for diabetes mellitus and metabolic syndrome. So those who have these diseases may have to good check for their testosterone also. Is that correct, Doc?
Yeah, that's correct. Actually, 50% of diabetic males have low testosterone. So that's why it's really important to screen for hormonal imbalance for anyone who has chronic degenerative diseases. Yeah, it affects everything, not just sexual health. And like we discussed earlier, it could affect your metabolism, it could affect your mental health. So some people with depression could just have low testosterone. So once you correct this, their depression goes away. Of course, cardiovascular health. I have a friend who just had his blood tested. His morning total testosterone was 150 or less. And
oh
imagine,
wow,
That's low. That's
yeah, the
low.
lower limit of normal is 300. So he told me
300.
his symptoms was cardiovascular. He was having palpitations and some chest pain. He had to go to a cardiologist, but they couldn't find anything. So he decided to come to me, and I told him to get his hormones tested. And lo and behold, he had a testosterone that of probably like a 90-year-old.
Wow.
Yeah, only in his early 50s.
So
Yeah, so
even if the levels are in within the normal range, if they have symptoms, they could be suffering with low testosterone disease deficiency already,
yes, yeah, that's true. Yeah,
and we have to address.
yeah, because most doctors just look at the normal range. However, we don't know a person's baseline. So let's say
Yeah.
the regular testosterone is 1,000, but if it goes down to 700, so it's still within the normal range, but that's already a 30% drop. So a
Wow.
person is symptomatic, even though it's still within the normal range.
I think that's what happened with me because I was in the normal range when we did the exams, but
Yeah.
I've noticed recently some drop of energy in the afternoon. Like there are
Mhm.
days that in the morning I'm very hyper energetic, and then suddenly in the afternoon, like a really drop of energy, and I feel like nothing. But then
Mhm.
since I started with the therapy, I don't have that anymore. I just maintain sustaining my energy level during the day. And at night I'm sleeping super well. I'm sleeping early,
Mhm.
sleeping the whole night, waking up strong and energetic.
Mhm. Well, that's wonderful.
Wow, that's so fast. You're just doing it for 3 weeks and lots of benefits already.
Yeah, we actually also had one client just recently. His issue was ED primarily, and he had himself tested before his initial consultation. So when we saw him, we got him started immediately. Then when he followed up after a week, he told us that he's getting some good results with just one injection. That's wrong.
Wow.
Wow.
Thanks, Sigfried.
How about physical symptoms that we need to check that we have low testosterone, sign of low testosterone?
Yeah, if a person has like if it's a person is skinny, they have less muscle mass, and if they have like a belly, they have like a huge abdominal fat. Usually, that's symptoms of hormonal imbalance, like low testosterone and high estrogen. So a lot of cops, a lot of cops have big bellies, so they probably
Yeah. Okay.
no offense to the cops out there,
Yeah.
but they should get themselves tested.
Yeah.
Yeah.
And I believe there is a thinning of the hair on the
Mhm.
body, and
Yeah, that
also a decrease in the size of the testicles and the sexual organ itself.
yeah, true.
Wow. So that's the importance of the TRT nowadays. Because I've been reading a lot lately as well how the testosterone level has dropped in the recent age because
Mhm.
of our lifestyle in general. And now with this treatment we can really prolong that vitality and that energy. And of course you have to align also with lifestyle, like
Mhm.
working out, eating well, and detox our body once in a while. That's why I'm always in the clinic, my
Yeah.
hyperbaric, take my IV. I felt a
Yeah.
huge difference since I started with the treatments in the clinic. Felt more
That's
energetic, more sharp, more clarity.
mhm. Awesome. And the good thing about it is that you could continue the treatments wherever you are. Because if not, is it okay to say this? You're gonna be
Yes,
moving
yes,
back. Yeah. So
yes.
Hideo will be moving back to his land of where he was born. So that would be
Yeah,
Brazil. Where? Brazil? Where?
Brazil. Yeah.
São Paulo.
Sao Paulo. Okay.
Yeah.
So it'll be a week from now. So good luck. Good luck to that.
Yeah.
Thank you.
Yeah.
So I'll be
So yeah.
continuing the treatment there as well.
Yeah, you could. We could still continue with the online consultations and everything. Yeah. So I think it's the time where we get questions from our audience. Are there any?
Yeah.
Are there any questions? Oh, there are no more questions according to Ralph. But anyways, yeah, thank you so much, guys, for being part of tonight's talk about TRT. Um,
Yes.
Go ahead, Sigfrid. Do you have anything to say to the audience?
Oh, thank you for guesting me again, Doc. And Hideo, thank you for also sharing your experience with TRT. Okay.
Yeah. Yeah. Thank you so much, Hideo. Do you want to plug anything? Do you want to say anything to our audience tonight? A lot of people are gonna miss you and
I would
Fatima.
like to say thank you. Yeah,
Yeah, miss you guys.
I'd like to thank you guys, and I will see you guys soon. I will visit the clinic next week.
Yeah, before
Okay. See you then.
before you leave, go get some treatments. Okay, so thank you all. Have
Okay.
a good night.
Thank you. Good night.
Good night.
Bye.
Bye.